Okay, well, we have hit 12 o'clock, so welcome everybody. Great to see such a good turnout today for our Tuesday edition of the weekly COVID-19 situation report. Very pleased to have you all joining us today. In addition to Dr. Salvatierra, we also have joining us Mayor Andy Mitchell, the Board of Health Chair, as well as MPP Dave Smith. I understand Mayor Diane Therrien might be able to join us later, hopefully. And we're also pleased to have with us today Chief Scott Gilbert from the Peterborough Police and Julie Ingram, who is the Manager of Environmental Health for Peterborough Public Health. And her portfolio also includes inspection services. So we'll be hearing from her later today as well. So as we gather here, I just want to take a moment to acknowledge this beautiful place that we call home, and acknowledge that Peterborough Public Health is located on the Treaty 20 Michisagauk territory and in the traditional territory of the Michisagauk and Chippewa nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. Okay, so moving on, we will now invite Andy Mitchell, Mayor Selwyn Township, our board chair, to say a few words to start us off. Go ahead, Andy.
Thank you, Brittany. As we enter the second week of a stay-at-home order, I would like to thank all the residents of the Peterborough region who have been adhering to its provisions and going out for essential reasons only. Remember, leaving home should only be for things we have to do, not for things we may want to do. Even though individual parts of the order may appear confusing, its intent is clear. Just stay home, except when absolutely necessary. Permissible essential activities are listed in the order and include things like going to work, getting groceries, securing medical supplies, and similar activities. It does not include leaving home to socialize with people you do not live with. Residents who own seasonal properties in the Peterborough region are an important part of our community and, like everyone, have an important role to play helping to curb the spread of COVID-19. The province is discouraging interprovincial travel. However, emergency maintenance to a secondary residence is considered a permissible essential activity. Frequent short-term stays to your seasonal property, however, do carry more risk. Also, if you lease land from First Nations, check to see if access is possible at this time. If your cottage is winterized, transitioning over for a longer stay can be a safer choice. The safest way to do this is to self-isolate or drastically reduce close contact with others for the first 14 days. Other helpful guidance is contained on our website. Remember, whether you live in the area all of the time or just part of the time, when you do leave home, remember to follow public health guidelines. Avoid assembling with people outside your household. Wear a mask. Maintain a physical distance of 2 meters. Wash your hands frequently. Stay home when you feel ill and seek medical advice. All of us have a role in defeating COVID-19. For some, it's being on the front lines as a healthcare worker. For others, it's performing essential work. And for many of us, it means staying at home and not becoming a vector for disease transmission. Stay well, be safe, and in all things, be kind. Thank you.
Thank you very much, Mayor Mitchell. Okay, and so with our latest situational report, I'll now invite Dr. Salvatierra to give us an update since we met last Friday. Go ahead, Dr. Salvatierra.
Thank you, Brittany, and thank you, Mayor Mitchell. So as of 4:30 p.m. yesterday, there are currently 49 active cases here in Peterborough. This is 2 less than we had on Friday. And we've started off the week. Yesterday we had 4 new cases. In total, we've reported 481 cases since the pandemic began. Our team here at Peterborough Public Health is following 105 high-risk contacts. That is a reduction of 8 since Friday, and it's 39 less than a week ago. Our community is now reporting 6 local deaths from COVID-19. Sadly, we lost another resident to COVID over the weekend. One of the 6 deaths reported of the 6 deaths reported so far, 4 have been in long-term care residents. 1 was connected to a congregate senior setting, and 1 was a community resident. We'll look at our new cases by report date. So here you see our 2 waves of the pandemic. We're showing you, you can see a breakdown here of the last 4 weeks by the number of reported cases. Our highest weekly case counts to date over the past 4 weeks was peaked at 71 cases for that week of December 28th, but we've been seeing a slight decline each week since then. However, if you look at the next slide, you'll see that January is still tracking to be our month with our highest number of reported cases since the pandemic began. We've already reached 132 cases with 10 days left. So I think we're on track to reach or to I can't think, to be higher than our December total. Next slide is our exposures, and with close contacts continuing to be the highest source of exposure for 65% of all of our cases so far. In the last 4 weeks, you'll see also that we've had a large number of cases resulting from community spread. And this means that although our residents are continuing to do a good job at self-isolating, we still have COVID persisting out in the community, people coming into contact with others, resulting in about 22% of our local cases from close contact, from community contact. Next is our case breakdown. As far as sex of our cases, you'll see we're back to the provincial norm of slightly more females than males. The bar graph also shows that the 20 to 29 age bracket continues to represent a large portion of our cases, 158 so far, and this is 8 more than since last Tuesday. For testing, approximately 40,600 local residents to date have been tested, or just over 1 in 4. And for outbreaks, we are reporting currently 3 active outbreaks in various settings. The outbreak at community living was declared over this past weekend, and the outbreak at Fairhaven remains stable with only 1 case. The 2 new outbreaks were declared since our last media briefing. One at Regency of Lakefield Retirement Home with 2 resident cases, and another at Centennial Place in Millbrook with 1 staff and 1 resident case. If we look at our case incidence rate, our map, here you see the rates across the province. Locally, our case incidence rate is 30 cases per 100,000. It's declined slightly from 33 cases per 100,000 last Tuesday. So I want to spend a few minutes just to speak about vaccines. The recently announced reduction in Pfizer vaccines shipments will have an impact on our provincial vaccine rollout strategy. Ontario will focus on still on getting those first doses into the arms of long-term care home residents, staff, and essential caregivers, but they will delay the second dose for healthcare workers over the next coming weeks. In other parts of the province, but not here, this will impact healthcare workers. But the province will follow the recommendations of the National Advisory Committee on Immunization, or NACI, and not allow those intervals to go beyond 6 weeks. As far as Peterborough, we have now been notified in writing that we will be receiving our first shipment of the Pfizer vaccine the week of February 1st. We will receive enough over the course of February 1st and February 8th to immunize all of our residents, staff, and essential caregivers in our 8 long-term care homes by our February 15th deadline. Together with our partners, we will be immunizing as many of the close to 3,000 people that wish to receive the vaccine during that first part of our vaccine rollout. I'm hoping to see a high coverage rate, a high acceptance rate in all 3 of these groups, as it will confer the greatest level of ongoing protection to this vulnerable population. And now I would like to invite Julie Ingram, our Manager of Environmental Health and our lead on the public health measures, to speak about the provincial regulations that were introduced last week. Over to you, Julie, please.
Okay, thank you very much, Dr. Salvaterra. It's been an interesting week with the new regulations that have been released, and we've spent a lot of time interpreting and making our best attempts to understand the regulations. And I did want to take a few moments and talk about the stay-at-home order, which was filed under the Emergency Management and Civil Protection Act, coinciding with the January 12th Provincial Emergency Declaration. Some of my comments are going to echo Mayor Mitchell's comments, who said it very eloquently. This order requires members of the public to stay at and in their place of residence and only leave for essential reasons. The essential reasons are outlined in the order, and they include things like attending work and school, accessing childcare, obtaining goods like groceries, attending medical appointments, and getting medication, just to name a few. The bottom line is that this order is requiring residents to stay at home. Just because you can go out doesn't mean that you should. So let's take a minute and really look at that word essential. If you look at the dictionary and the definition of essential, it means absolutely necessary. This isn't going to last forever, but it is what's needed right now. So consider why you're thinking about going out. Do you want that thing, or do you need that thing? It must be a need, and it must be extremely important to justify going out. If you're leaving home for essential reasons, do your best to stick to the jurisdiction in which you reside. If you work in another jurisdiction or have a medical appointment elsewhere, these are unavoidable. But please don't go use recreational amenities in other areas simply because they're available. Stick close to home. Public health inspectors are provincial offences officers and will enforce the emergency orders and the regulations under the Reopening Ontario Act and the EMCPA. If necessary, charges will be laid with fines ranging from $750 to $1,000. In addition, our public health inspectors can and will require individuals to identify themselves, close a premise if there's grounds to believe that a gathering is occurring, and require individuals to disperse if a gathering is observed. We continue to work closely with bylaw enforcement officers, city police, and the OPP to ensure consistent approaches to the enforcement of the regulations within our area. In addition, we are actively working with the Ministry of Labour to consider targeted approaches for inspections, and locally we are currently planning a blitz of grocery stores and supermarkets, which will be implemented in the near future. We have actively conducted surveillance of parks and public spaces, and I do expect that this will continue. We still are receiving many complaints on a daily basis that public health inspectors are responding to. We're doing our best to triage these complaints and prioritize them to get more boots and shoes on the ground more frequently.
Things are very fluid in our enforcement response right now. We have our promotion team working very hard to provide the information to key sectors and sectors where we have seen issues of non-compliance. But with all that said, I do want to say that overall, we have seen a high level of compliance by businesses, and we know that they are taking action and continuing to do what's needed to protect our community. We have issued many warnings to businesses, which results in quick and ongoing compliance. As of yet, I am pleased to say that we have not had the need to lay any charges under the EMCPA or the Reopening Ontario Act. I hope that continues, and I think we all have a part to play in that as well. And thank you.
Thank you very much, Julie. And hopefully you can stick around when we get to the media questions in case people want to find out a little bit more about what you have presented. So thank you for sharing that. With that, we'll now invite our elected officials to share a few comments. And I see that Chief Carr has been able to join us from Hiawatha First Nation. And Chief Carr, if you have any comments you'd like to share, please go ahead, or we can just keep you on the line for questions if you'd like. Just let me know.
Hi, Brittany, and good afternoon, everyone. I just have a couple of comments. I just wanted to first say thank you for these calls. They're very helpful. And secondly, to everyone out there who is working so hard to, get us through these challenges of the second wave and the patience that is needed, as Mayor Mitchell noted earlier. It is really challenging, and we ask for that patience, especially in my community, to as we get through this, that we are kind to each other and to remember our teachings as we move through having to stay at home. I know it's challenging for everyone, so I just I'm always taught to give thanks first, so I'd like to give thanks to everyone. And secondly, I just wanted to provide to let people know that are outside of here that we do have our order in place. So we have a stay-at-home order in place, a shelter in place. We've also remained closed to visitors and the general public, and our store is only open to inside the community citizens and residents that live here. But we've shut down everything else in regards to our community, and I give thanks for those people that do come out and support our businesses when we're, outside of this COVID and shutting down, and just say thank you, and everyone be well and be safe.
Thank you very much, Chief Carr. And I should have mentioned before that for any of our elected officials, if you do have a camera and would like to turn it on, I can certainly spotlight you while you're giving your comments. So now I will invite, I see our MP, Miriam Monsef, has been able to join us. Miriam, did you have anything you wanted to share? And would you like me to do you have a camera you'd like to put on?
Sure thing, Brittany.
Okay, great. There you go. Go ahead.
Hello, colleagues. Bonjour, Anin. Salam alaikum. From my home to wherever you are doing this very important work, I too will take my lead from Chief Gar and begin with thanks to everybody who's going above and beyond to respond very quickly to the challenges that come our way, to interpret the changes that are coming, and to make them understandable for the rest of us. To our colleagues who are working very hard to contain outbreaks, and to those who have, we thank you. And to the little ones and the parents and the teachers and the essential workers who are keeping our community going, this is truly a difficult time for us, but we are Canadians. And tough winters, as Minister Freeland remind us, well, Canadians can handle tough winters. I know that folks are getting restless and some are thinking about taking vacations, but if you are thinking about going away, if you're thinking about international travel, please don't. If you've made plans already, cancel them. It is not worth it. Non-essential travel puts you at risk and so many others, and it's just not worth it. And there is good news coming. As Dr. Salvatierra said, the vaccine is coming to Peterborough, and the rollout will be the most significant vaccine rollout in our history. And we have thoughtful, skilled people who are going to help with the rollout, but every individual has power to help by staying home, by following public health guidelines, by staying a little patient, a little more patient for a little bit longer. You will ensure that the vaccine rollout moves forward smoothly, and you'll help ensure that we find a new normal at last. Thank you. And Brittany, I will stay on the line for any questions.
Wonderful. Thank you very much. So glad you could join us. Okay, I'm going to now invite our MPP, Dave Smith, to share his comments, and I will gladly spotlight you as well. And let me just get the buttons pressed. There we go. Okay, there you are.
Thanks, Brittany. I appreciate that. As Dr. Salvatierra has mentioned, the infections here in Peterborough have come down, and we're seeing it actually province-wide. It is starting to subside on a daily basis. The reproduction rate, though, is still above 1, and that means that for every person that gets infected, they are infecting more than one person. We need to get it below 1 so that the virus starts to die off. And that means that we need to continue being diligent, washing your hands, disinfecting, and stay at home. It's been said so many times, but it needs to be repeated. If you don't need to go out, please do not go out. The sooner that we can stop this virus from spreading, the sooner we can have some of our old norms back, like getting together, like enjoying time with family and friends, going out and doing the things that we used to be able to do, that we want to be able to do again. So the sooner we stop the spread of the virus, the sooner we'll be able to do that. On the vaccination side, it's true that we have a little bit of a blip right now in supply. We're going to have 20% less of the Pfizer vaccine in the next delivery and 80% less in the delivery after that. But then it'll ramp up again in March. At least that's the understanding that we have from it. We will continue at the provincial side increasing our capacity so that we can deliver more of those vaccines as the vaccines come in. We're well over 200,000 people now who've been vaccinated. I believe we're actually above 250,000 at this point. We're getting very close to having the ability of vaccinating 50,000 people a day. It is over 40 at the moment, and we're building towards a capacity of 250,000 a day. That's all good news. We're still moving ahead as if we have a steady supply so that when we actually have that mass amount of vaccines coming in, we can get them into people's shoulders. I'm really looking forward to that day where we're not having these meetings by Zoom. We're actually able to have them in person again. Stay diligent and stay home. Thank you.
Thank you very much, Dave. Great to have you share your thoughts with us today. And I don't see Mayor Therrien on the line yet, but we are fortunate to have Brendan Wedley here who can take any questions back to her if some come up. I'll just check in with Chief Gilbert if he had any comments, or Chief Gilbert, would you just like to be available for any media questions?
I don't think there's anything else I can add at this point in time that the MP or the MPP or Mayor Mitchell or Julie Ingram has already stated about the situation we're in and the request that people comply with the orders to stop the spread. So I'm available for questions if need be.
Oh, okay, great. Thank you. All right, so I will now invite questions from our media partners. Perhaps if Dr. Salvatierra and Julie could also get their cameras on in case questions come your way. Let's start with Taylor Clydesdale from Peterborough This Week. If you've got some questions for us, Taylor, please go ahead.
Hi, yes. Thanks, Brittany. Just a couple of questions for Dr. Salvatierra and then a couple for Julie. So Dr. Salvatierra, just looking to, we're hoping to have the first doses of the vaccine in people's arms in long-term care by February 15th. Is there a plan for seniors not living in long-term care, so those out in the community and those living with family members, or are they going to have to wait until the spring when mass vaccination rolls out?
So, so you're correct. Right now, community individuals will be done by ages, but that's currently in the phase 2 of the vaccine rollout, which means when we have more vaccine available, and that's predicted to start anywhere March to April. The only exception to that, Taylor, would be those adults, older adults who are chronic home care patients. So someone who is quite fragile, who has a visiting nurse, for example, is in phase 1. We still haven't heard how that group will be done yet, whether it'll be public health or whether it'll be CCAC, but they are in phase 1. Everyone else, if you're not currently a resident in a long-term care home or retirement home or congregate senior setting, or you're not a home care patient, right now you are in phase 2 for when we get more vaccine available.
Okay, and just to clarify, so the delays with the doses of the Pfizer vaccine isn't going to impact the first dose that's supposed to roll out in early February. That's correct?
Correct, in that we are getting vaccine as had been anticipated. So we've had no change to the date of our anticipated shipment. Where we probably have seen changes in the allocation. We won't have enough until the February 8th shipment to be able to complete all of our 8 long-term care homes. But we do expect to have all of our long-term care homes completed in time for the February 15th deadline.
Okay, and then the second dose, even with the delays, is still expected to take place within 6 weeks of the first dose.
Correct. Well, for a long-term care home, we hope to get that second dose on time, which is 21 days, between 21 and 28 days for the Pfizer vaccine. However, if we need more time, we do have the recommendation from NACI that we can go as long as 42 days. That's not ideal, but that is currently within the recommended interval.
Okay. I think that's all my questions for you, Dr. Salvatierra. Thank you. Next, I'll just pass it over to Julie Ingram if she's still available. You mentioned a grocery store blitz. I'm just wondering if you could go into more detail about what that entails.
Yeah, for sure I can, Taylor. We are still in the early planning stages of that, and there's actually 2 sides to this. So there's going to be the blitz that our enforcement team, so our public health inspectors, and even our tobacco enforcement officers, who are also provincial offenses officers, we're going to be going into all of our grocery stores and supermarkets. Now, that's not to say we haven't been in them. We have definitely been in them on a reactive basis in response to complaints. We haven't been able to take as much as a proactive approach just because of the sheer volume of complaints that we're getting. So we do plan to go into the mall with a checklist that we're currently developing, and it'll be an approach similar to some of the news reports that have come out of like Durham region, Toronto, Hamilton, looking at all of the various public health measures that are expected for these stores as essential businesses that are still open, and making sure that they are doing absolutely everything they need to be doing, issuing formal warnings and charges when we need to. So it's one of the sectors that we are switching to a proactive approach, and I'm meeting with the Ministry of Labor tomorrow to talk about that a little bit further, as well as other ministries for the local task force that we're hoping to bring in probably mid-February.
Okay, and these formal warnings and charges, are planning to be issued to the grocery stores and supermarkets themselves, or are these the shoppers within them?
I foresee that it would be more so to the business and the persons responsible for the business. There's few situations under the regulations that individuals themselves can be charged. We do know that there is the ability to charge for lack of compliance with masking and face coverings, but we do have to be cognizant that the exemptions do still appear in the regulation.
Okay. You also mentioned in your piece earlier just about that there have been some warnings issued to businesses. Can you go into greater detail about what those warnings have entailed?
Yeah, so it's situational dependent for the most part, but as an example, when stores have exceeded what their capacity should be in order to maintain physical distancing, or if too many cash lineups were open so that physical distancing wasn't possible, or inadequate physical barriers, inadequate signage. It's all those types of things that we've issued formal warnings for in writing to these businesses. And as I said, with that approach, it's very quick to get the compliance, and then that compliance tends to be ongoing from that point forward.
Okay. All right. I think that's everything for you. I guess maybe I'll pass it on to the chief then, if that's all right, for one final question. Just how have things been going from the police's perspective in terms of the stay-at-home order? I know Dr. Salvatore mentioned that there haven't been any fines laid so far, but how has the police force been reacting to this so far?
Well, our response has been basically complaint driven. So if somebody calls up and says that they're observing a breach, then our officers will respond to that. As well, if our officers see a breach, then they respond to that. As I said, for a large part, it's complaint driven. Over the last few days, we have laid a couple of charges in relation to the provincial lockdown order, as well as one Quarantine Act violation under the federal legislation for a traveler who'd returned to Canada and then didn't self-isolate for the mandatory 14 days. So that's as far as we've got for enforcement at this particular time. Majority of people are complying with what's being asked of them, and that although Dr. Salvatore indicated we've had 6 deaths and our percentage is above 1%. Our community is doing much better than other communities because our people are paying attention to what's going on. They're being respectful to others, and they're taking all the required steps to make sure that they protect their neighbors.
Okay. And sorry, just to clarify, so you said that a couple of people have been charged. So 2 people have been charged with in the Peterborough area with violating the lockdown order. That's correct?
With the EMCPA and the ROA. And one under the federal quarantine legislation.
All right, perfect. Thank you so much, Chief. I think that's all for me. Thank you so much.
Okay, thank you very much, Taylor. Okay, so now I will call upon Matt Latour from Oldies and Freak Radio. If you would like to ask your questions, go right ahead.
My first question is for Dr. Salvatore regarding the vaccine arrival on February 1st. You mentioned there will be enough vaccines coming for all the residents in long-term care homes locally. Does that include both doses?
No, it'll only include the first dose. So we will use all of our shipment up in order to get first doses in people's arms. But we will be expecting weekly shipments starting in February 1st. So the second dose will come later.
Do you have a number? And if you mentioned it, I apologize. Do you have a number on how many vaccines are coming on February 1st?
I don't have a number that I can share publicly. I've had some internal communications for planning purposes, but we have got a number as far as how many people in the long-term care sector we will be immunizing before February 15th, and that's about 2,900. I said earlier, close to 3,000, and it'll depend on what percentage of those people will consent to be immunized, how many of them want to be immunized. It is a voluntary vaccine, but we are working closely with our long-term care homes. I did send a letter to all long-term care staff, and we are hoping to get that acceptance rate up as high as possible.
Perfect. And my next question is for Julie Ingram. You had mentioned that public health had gone into some grocery stores and whatnot based on kind of a reactionary basis. Is this something you're getting a lot of calls about, or would you encourage more people to do so?
Yeah, no, that's a great question. We have a great complaints forum on our website. It's a form that people can fill out with all the details for the complaint, and you can also call into our hotline. We certainly encourage those calls because it gives us an idea of what is happening in the community and where some of the hot spots might be and some sectors that might need some additional support. So yes, if you, as a member of the public, if you do see violations, we do encourage those to be reported to us. And regarding numbers, yes, we're still seeing a lot. We get a lot of them. What I will share is that not every complaint that comes into our office is something that is enforceable. For instance, if you're shopping and somebody leans over you to get something, unfortunately, there's not a lot we can do about that type of situation other than consulting with store managers and encouraging their safety ambassadors for COVID-19 public health measures to be monitoring for that type of behavior and talking to customers. But again, this is where I do want to emphasize that as much as there is a responsibility on business owners and operators, we each have a responsibility to make sure we're following the basic measures, and that's physical distancing and wearing a face covering and sanitizing your hands before you go into a store.
Perfect. That's it for me. Thank you.
Thanks, Matt.
Thank you very much, Matt. Okay, so joining us today, we also have Danelda Fraser, who's from the Havelock Rail. That is a monthly publication, a magazine that serves our eastern part of our community. So Danelda, if you have any questions for our spokespeople today, please go right ahead.
No, I don't have any questions. I'm just observing today.
Okay, great. Well, wonderful to have you join us today. So now I'll invite Jessica Nisnik from Global News. If you would like to ask any questions, please go ahead.
I'm actually okay for questions today. Thanks, Brittany.
Okay, great. Making it easy on us. Okay, Joelle from the Examiner. Do you have any questions for us today, Joelle?
Yeah, I definitely do. Dr. Salvatierra mentioned, unfortunately, there's been a 6th death in the community. You did mention a little bit of detail about the 6 deaths, but you did say that one of them was connected to a congregate senior setting. Is this the most recent one? Is this the 6th death that occurred?
Yes, Joelle, that's the 6th death that has occurred.
Okay, great. It sounds as though there will be a longer period than anticipated between the first 2 doses for the long-term care workers. Can you talk just a little bit about the protection that's afforded from that first dose? Like, they still do receive a certain amount of protection after that first dose, right?
Certainly, but let me just correct your first assumption. I don't anticipate that there is going to be a longer interval between dose 1 and dose 2 for our long-term care homes. I think I said earlier, we are expecting weekly shipments of vaccines, and we will ensure that a portion of those vaccines will be used for the 2nd dose. So we are still anticipating, aiming for 21 to 28 days between dose 1 and dose 2 in our long-term care sector. And you are correct. There is a benefit that begins to kick in 2 weeks following the first dose, we should see some protection in individuals. Now, the only what we don't know is and this is where the controversy has been between 1 dose and 2 dose. We really have no data whether 1 dose is sufficient, whether that is going to be a sustained immune response. So there is a need to get that second dose in order to ensure that people have a robust and sustained immune response to the COVID-19 antigen.
Okay, so perhaps I'm a bit confused. You did mention something about there being a period, there might be instances where there's as long as 42 days that go between doses. Can you re-explain that, please?
Yes, for other parts of Ontario where healthcare workers have been immunized, those healthcare workers may need to wait a little longer for their second dose. There is no plan now to make long-term care residents wait longer. They are a priority to receive both first and second dose of vaccine. Does that help?
I think so. I had the impression somehow that this Pfizer delay would affect the administration of these 2 doses of long-term care, but it doesn't sound like it. I think I'm mistaken.
Not expected.
Okay. That's good. Okay. And I do have a question for Chief Gilbert, if he's still on the line. You talked about these there was 2 EMPCA tickets. Is that $880? Is that for gathering and breaking the stay-home order?
Well, those are probably for larger gatherings than what you're allowed under the regulations. I don't have all the details on the charges. I just know that there was 2 laid. The actual fine is $750, but with the victim fine surcharge, it comes to $880.
Okay. Is the other one similar for breaking quarantine? Is that the same?
Well, it's federal legislation, and I have to look at the specifics of it, but usually under federal legislation, much like a criminal code offense, first offense is usually summary conviction. It could be a fine and or a period of incarceration up to 6 months. But I'd have to know exactly which section of the Quarantine Act they breached in order to give you the specifics of what fine they potentially would be looking at on conviction.
Okay, that's about all I had. I'll pass it on to whoever else is on the line. Thank you.
Okay, thank you for your questions, Joelle. I see that Taylor has his hand up, and maybe if you'd like to ask your question, and then we'll move on to the other media who are still on the line with us. Go ahead, Taylor.
Oh, yes, sorry. I just was going to circle back around to the chief again to ask if there was any more information on those 2 people that have been charged, but I think in answering Joelle's question, the question has been answered. Unless there's anything more that you'd like to add about those charges.
No, that's it for now, Taylor.
All right, perfect. Sorry about that. Thank you.
No problem. That's great. Okay, I see Trent Radio's on the line. Does our reporter from Trent Radio have any questions for us today?
Hi, it's Rob from Trent Radio. I don't think so, actually. I think all the questions I've been asked already have gotten everything I had.
Okay, that's great. Well, we aim to deliver. So Paul Rellinger from Kawartha Now, if you've got some questions, please go right ahead.
I do. Thanks so much, Brittany. Actually, a question or 2 for Dr. Salvatore, and if I may, one for Julie Ingram as well. Regarding, I'm sorry, I know you gave out information already regarding the most recent death. I just want to get a clarification. You said it was a congregate senior setting?
Yes, that's correct. So a place where more than 1 household of seniors resides.
Okay, now that's not the same as a congregate living facility, which 2 of them were an outbreak last week.
Well, it is similar. I think we use the word congregate in the same way, Paul,
Okay.
to identify those settings where you have multiple people sharing some common areas like dining, for example, or in some situations, washrooms. Those would be congregate settings.
Okay, and just one more thing on that. At the congregate senior setting where this occurred, unfortunately, were they an outbreak or is it?
No, they weren't. And when we first became aware of this case, we did a risk assessment of the setting and determined that there were no other high-risk contacts, and there was no need or indication to declare an outbreak at that time.
Perfect, thank you. And just one more thing, Dr. Salvatore, regarding the vaccine and long-term care homes. I think you mentioned the figure of the number of people you expect would get it. That tells me that I know you've sent out permission forms for the vaccine. Like, is there a high compliance, or is that what we can read into that?
I can't, I actually don't know, Paul, whether, and I'm not sure whether we've asked for that information yet from our long-term care homes. We definitely will need it though, because we can only move vaccine once. Once it's out of its frozen state, once it's thawed, we're not allowed to move it again. So before we go out to each of the long-term care homes, we will need to have all of the consent forms into us. We will count those forms, and we will only take enough vaccine in order to do the people who have provided us with consent.
Okay, so short answer to that, it's pending.
I guess so, yes.
Okay.
Pending, yes.
Yeah, I'm a little premature with that. I thought those forms had already come in, so I apologize.
Not to us, not to us. They may have come into the home, but we haven't asked for them yet.
Okay, thank you. And thank you, Dr. Salvatore. And I also had a question for Julie Ingram, if I could. And it's regarding, we saw much, Julie, on the weekend about big box stores in the GTA and inspections and charges laid. Were inspectors out at big box stores locally over the weekend, or since the stay-at-home order has been put in place?
Yeah, locally, I can say we haven't done any weekend surveillance of our big box stores, but that's pending. That's what we're working on right now. This past weekend, our surveillance actually focused on some of our public parks and public spaces.
Okay, so when you mentioned food stores earlier and how they're going to be subject to some kind of inspection coming up, that also includes big box stores.
That's right. Yeah. So it'll include big box stores, grocery stores, supermarkets, and we're waiting on a decision of another sector that we're potentially going to be looking at as well.
Okay. Thanks so much, Julie. And if Scott, Chief Gilbert is still on the line. Sorry, I had one question or clarification, if I could. Chief Gilbert, there you are. Just wanted to ask, you mentioned the charges, and I just want to clarify that 2 were laid under the stay-at-home order provincially, and a separate 1 was federal, so 3 people, 3 charges?
That's correct.
Okay, I just wasn't sure one of those federal charges was related to a provincial charge as well, so it is 3 people.
No, returning travelers, we get notified through the OPP and the RCMP of people returning to Canada that are required to self-isolate for 14 days, and we're obligated to go and check on them to make sure that they're complying with the federal isolation order. And for the most part, we've had great compliance with that. There has been the odd blip where we have to lay a charge, and in this case, that's exactly what we did. The person wasn't complying.
Right. Okay. Thanks so much, Chief Gilbert.
No problem.
That's it for me, Brittany. Thank you again, as always.
Okay, great. All right. Well, I believe we've been able to get through everybody on the line. So thank you all for joining us. Special thanks to our guests today with Chief Gilbert and Julie Ingram. So that wraps us up for Tuesday, and we will see you back here on Friday at noon. Okay, thanks all. Bye-bye.
Thank you.
Thanks, Brittany.
Thank you.